hello everyone. My name is Petra. I will adjust this a little bit. So that's fine. Yeah. So I'm from Ryder, and very short about Ryder, we say that we are a human innovation company, and we believe that technique shall be smart, it shall be user-friendly, and delivered with a human touch. However, the Brighter group has actually three operational entities, and I will mention us shortly about them because one of them is actually the reason I'm here. So I will start with the Nectarine Health, and you guys worked with Nectarine, right? Yes, and developed a very smart wristband that collects data to help professional caregivers to monitor seniors in need of care. And the wristband can detect patterns of behavior in acute events. And since it's based on an AI platform, it will eventually also be able to predict events, we hope. So, and another interesting company is Camanio. It's a welfare technology company that offers a complete solution for a smooth transition to digital home care, and with an interface that allows the caregivers to tailor the digital ecosystem in the home of the elderly. They can administer support systems as security alarms, sensors, or even cameras. I would also like to mention Akumbo. It's a telehealth provider that we have invested in, who successfully launched a service, Blodtrycksdoktorn, that is hypertension doctor. For anyone with a high blood pressure, I recommend you to download that app. It's great. And I really think forward to continue collaborating with them and writers and Akumbo's new services for those living with other chronic conditions such as diabetes. Definitely future to look into. But we should look at the big picture and okay. There we go. So what do we have on, around the corner in respect of talking about health? We know that we have a huge population growing from 7.8 billion people, and it will increase to 1.7 billion in 25 years. This population grows older, we have a lot of chronic diseases coming with it, and to this we of course see limited resources. But on the other hand, we also have enormous potential in the tech development, the innovation. I'm talking only about Sweden. We have always been in the top of the innovation, innovative countries in the world. We have a large social engagement. You can really reach out to the world if you have an engagement. Look at Greta. However, as Gerard mentioned, we spend a lot of money taking care of the sick instead of investing in the healthy part. So we know that for EU, for example, we spent nearly 700 billion euros on only chronic diseases. That is 70 to 80% of the total spendings. And then we don't even have added, of course, the effect of Corona. This was before Corona. We have a new abbreviation. BC is before Corona, and AC, I hope we will see after Corona. So we have huge challenges, and chronic diseases is absolutely one of them. Of course, infections and less effective vaccines for different diseases also within the picture of the healthcare that will be taken care of. But let's look at the journey of chronic diseases. From the diagnosis, there is a long time frame to keep on track to avoid the secondary complications to the condition. So this illustration will show you a person that then walks into a hospital or a care center to just have an ordinary health checkup. But from that checkup, it comes out that this person has, for example, hyperlipidemia. So that is high blood fats. And what does that mean? How the doctor will do a prescription, you go to the pharmacy or you order it by online maybe. So you have a medication and maybe some lifestyle recommendations. So But you are handling this on your own at your home. And of course, this is quite a long time. This time frame from when you get the information that this is your condition to when you notice that you actually have a disease that can be 10, 15, 20 years. So this is why I mention hyperlipidemia, is because it's a silent disease. And that is also a bit similar to diabetes, which I will talk about more later, since Brighter's first solution to the market is Actist, working on diabetes management. And that is our IoT health solution. But however, diabetes is also a silent disease, which very much this picture resembles. So you have a type 2 diagnosis, you have a medication, a tablet, you have lifestyle recommendations, but you don't really know that you're sick every day. So you don't have the instant feedback that you did something wrong. This is why we are spending so much money, I believe, on the acute care instead of the prevention. Why it costs us so much in the society? Because it's quite natural. Now I'm pointing at the screen and you don't see that. But if you are having a meeting with your doctor or nurse, they have invested all their competence and time in you when you're at that meeting. Over the phone, digital meeting or physical meeting, doesn't matter. But they don't have time to take care of you when you are at home. That we need to do ourselves. So the problem is that sticking to this plan and the recommendation, that is difficult. We maybe lack knowledge, we lack support, and definitely it's about motivation. And this is my arena about behavioral change and behaviors and what is the driver of motivation. Really tricky stuff. We know ourselves, don't we? The cozy corner in the sofa is much better than a walk in the rain, or even taking a tour to the gym. You stay probably in the sofa if you're not having a really good motive to go to the gym or go for that walk. So it's hard. What does this mean? It increases risk of complications for those with those chronic diseases. That builds an enormous economical burden for society, and of course, loss of life quality for both the patients and their loved one. So everyone loses in this situation. It's ineffective use of healthcare and so resources all over the picture. We know that 50-60% of the patients with chronic diseases, they miss their doses, take the wrong dose, or drop off treatment even. So it is a tricky situation. This was maybe a headline for this seminar from my side, or for my part, the healthcare to self-care, mind the gap. And we know about this gap. The blue part in the picture, which represents the physical healthcare, is there. We have excellent care in the West world, and in Sweden especially. And the problem is when we get home, we need to take care of ourselves. In the case of a diabetes patient, this is over 8,000 hours on your own. And maybe you have 2 meetings with your healthcare professional per year. And the rest of the time you're on your own and you need to do the right thing. So that's difficult. I would like to have the time. What?
8 minutes left.
8 minutes left.
No problem.
All right. So this gap, we know about this already. And the thing is, we have all the digital tools. We have an excellent mobile network. We have internet access, and we have a high penetration of smartphones. So everything is there, but we don't have those health applications. I would just like to do a resemblance with the bank, for instance. Let's say 10 years, 15 years ago, we went to the bank office, physical meetings with someone working in the bank. That person took care of our money, and we had to ask them, how much money is in my account? Can you please move the money? Can you please invest the money? maybe we could go to an ATM machine and get a receipt and say, ah, good, whew, I do have money left on my account. Good, I didn't spend it too much. That was the situation. We were not in control. But bank industry or the segment, they saw, oh, what can we win? They used all this technology and saw, oh, we can reduce this burden on our business because it will cost us a lot with the offices. Let's make the users, empower them, give them the knowledge, give them the tools to actually do their banking themselves. They did, and we are happy with it. So they got happy customers and reduced cost, and could invest that time in other and provide even better service. Of course, that is what we will see in healthcare as well, and it's happening now. And why I mention this is because it's significant. For years, technologies have been available, but they weren't focused to ensure the right conditions, not necessarily on the user or patient side, but on the provider side, on the health system themselves. So I hope what we are living in right now is the transition. It's happening now. We have been talking about it for a decade. Now it's the time. And this will change business models, and it's going to have a dramatic impact. And the health system will actually demand this to happen. And I believe, and many with me, that's not my words, that this will happen with a triple helix, with the industry, with academia, and with the research. And well, I also see trends in the market. If you look at US, for example, there is a big company called Livongo that do a bit like the same that Brighter does. And they have a connected blood glucose meter. And then they have a telehealth company called Teladoc. They merged less than 2 months ago, roughly. The value that company is estimated to be is around $40 billion US dollars, 37 billion US dollars. It's huge. And that has not been seen before. And that was the third biggest merger in the US this year. That says something about where we are going. It's happening now, and we need to take care about the IoT solutions and the opportunities. So necessity is the mother of invention, someone said. I say necessity is probably the mother of change because we had all the inventions at hand if we're talking about healthcare at least. We have seen a massive wave of adoption of new solutions overnight. Corona hit us, and then we suddenly saw that we have access to health apps for digital meetings with our in public health service, which was actually available in the Stockholm region already a year or 1.5 years ago, but the healthcare system didn't implement it. Now we see that's happening. So it is an instant change in both attitudes and workflows, and this is behavior change. It works. I will give you a short insight in what Actist is, since I mentioned it. And you can look at the website if you want to have more information. Actist is diabetes management. It's a service. It's a platform. It's an ecosystem where we want to support everyday life among diabetics and those living with diabetes that has an insulin treatment. So what you see, the black part in the middle of the picture is the Actist, and you can measure your blood glucose, inject the insulin, and there is also a built-in eSIM, and so it has its own mobile connection. And with this, of course, the user can track their data. So it's about making sure that you know what you have done to help the users, to empower them. And this transition, we want to drive this transition from being unsecure on did I do the right thing to have peace in mind. I'm confident I took the right dose. And even if I just take a dose in the morning and the evening, I will have that information in the app. So it's about to simplify, to improve adherence, and to reduce this gap. This is the way to use IoT health to reduce the gap between the healthcare and self-care. And there are many more solutions like this out there. So I would like to say there are 2 minutes left, and I will leave a bit room for questions if there is. And I would like to say thank you, and also let's work together along this journey and reduce the gap.
Brilliant. Thank you very much, Petra. We have some question here. Have you seen change among the public health organization other than video meetings? Is there other changes that you can see right now happening?
There are probably enormous change coming after this. Yeah. And but I say that digital tools is one. Remote monitoring. I saw a project with Södertälje Hospital, and they monitor their COVID patients at home for blood pressure, for example. And that, what I know, hasn't been done before. I know that we have had that for hypertension. If you have a patient that you want to monitor for 24 hours, but not someone that came in for an infection and they want to monitor. I don't know if they did a saturation for the oxygen as well, which has been relevant for COVID. But however, yes, changes are happening.
Yeah. There is another question related to how Brighter make user change, how you make users change their behaviors, like practical tips to drive users to follow treatment programs, besides them knowing that taking the dose is the right thing. I mean, how do you have some tangible examples of that?
Thank you for that very good question. Yes, and that is the key with that artist. It's just that is the key, just to collect the data, and the task for the company and for us is to feedback on that data and to build such a relation with the user so that they feel empowered, motivated, and connect on the patterns that we can see. And of course, adding AI and machine learning to this is I wouldn't say a no-brainer because this is difficult, but of course an important step because it's all about pushing to next step. If you have, let's say, a user where you have not reached target for blood glucose, for example, then of course, what is the problem? Is it that they don't know? Do we work with education, or is it just a motivation? That we will be able to find out when we have a relationship with the customer, with the app.
Yeah, it's really interesting to see these parallels and especially smartphones being something that you barely can put out of your hand.
Oh no, we are attached to them.
Yes, for sure. Okay, did we have some more questions?
No more questions.
No. Then thank you very much, Petra. Thank you for your presentation.
Thank you for coming.